Egypt hosted on Sunday the first edition of Africa Health Excon, the biggest medical exhibition and conference in the continent under the auspices of President Abdel al-Sisi. The conference is held under the slogan, Your Gate to Innovation and Trade at Al-Manara International Conference Center in New Cairo District. The conference, organized by the Egyptian Authority for Unified Procurement, UPA, saw the participation of 2,000 delegates representing government health entities from Africa and the Middle East. Over 350 companies operating in more than 102 countries took part in the conference, unveiling the latest medical technologies and outlining the best practices for sustainable health care in the continent. Africa Health Excon includes 350 sessions and 20 workshops featuring more than 800 international medical speakers and experts. The conference sessions showcase the latest technologies in the field of medicine, as well as initiatives that support the Africa Excon as a sustainable platform that connects international healthcare partners together. In this regard, the conference offers a unique opportunity for global representatives of the healthcare sector to explore innovative medical supplies and equipment, as well as other medical fields. The initiatives to be discussed during the conference include the Egyptian Cervical Cancer Elimination Initiative that aims at protecting Egyptian and African women from cervical cancer. This is in addition to the Egyptian Presidential Initiative for the Treatment of Spinal Muscular Atrophy cases launched in mid-2021. Sessions of the conference will discuss various topics, include medical tourism, public health, and population challenges. Africa Health Excon will also offer training opportunities in the medical sector through sessions and workshops. The conference also stimulates Egypt's leadership role in line with its strategic vision and supports the infrastructure development strategies implemented in the African countries to boost the quality of healthcare services offered to their peoples.
مصر فيها 100 مليون، مصر كمان مساحتها مليون كيلومتر مربع، بس في حجم ضخم جدا من الأراضي احنا مش عايشين عليه. ما خدناش بالنا على مدى 60-70 سنة فاتوا إن الكلام ده هيبقى ليه تأثير كبير جدا وخطير على حياتنا ومستقبلنا. لكن احنا مش سايبين لا القاهرة ولا اسكندرية ولا بورسعيد ولا المحافظات، بنتحرك في كل القديم والجديد مع بعض عشان يليق بينا ويليق بالمصريين يعني.
Welcome back. You're still watching the daily debate. As we did see in the break, the new Republic of Egypt is cooperating with the African brothers, and more specifically in the fields of health, as we did see today in the presence of President Abdel al-Sisi at the Al-Manara International Conference Center, to be focusing on the future of health in Egypt and in Africa, and more cooperation, of course, between Egypt and the fellow African brothers. And I'm honored to be having with me in the studio tonight to be focusing on such an important topic Dr. Saied Abdel, the former Dean of the Faculty of Medicine at Al-Mansoura University. Thank you very much for being with us tonight.
Thank you, and good night for you and all the viewers.
Anytime. Of course, Doctor, you were there today at the first African Health Conference held in Egypt. What is the importance of having such an idea, and would you pass the experience to the audience?
Indeed, it was a remarkable day. We used to consider the 5th of June as a stigma following the 1976 defeat.
Yes.
But I think the reopening of the canal in 1975 was one important event, and today the 5th of June is another important event because for the first time Egypt holds a mega conference aiming to boost cooperation and integration with all African nations.
Yes.
The conference, the scale of that conference is unprecedented in Africa, and I don't think it has happened with this extreme. Just an idea of most of the international pharmaceutical companies all over the world, including
yes.
the mega companies, were there.
Thousands of representatives were there.
Absolutely. And for the exhibition, it was aiming to cover medical, dental, as well as pharmaceutical. So the three disciplines were there. In addition to the conference for the first time have ever seen 28 lecture halls running at the same time with thousands of scientists from all over the world, not only from Africa.
Yes.
So in that magnitude, I haven't personally attended such an event. The first half of the day was the opening of the exhibition and conference. We were privileged by the attendance of His Excellency the President, but also the three organizers for that. This mega event is organized by the Ministry of Higher Education and Minister of Health, His Excellency Dr. Khalid Abdel,
yes.
Also by the Egyptian Authority for the Supplies, what we call it the Unified Procurement Authority, and the Egyptian Drug Authority. These three, if you consider Professor Khalid Abdel holding the two positions for both health and higher education, so we have a tripartite event that covers thousands of people at the same time in all disciplines, covering clinical pharmacy, dentistry, all fields of medicine. So I was speaking today in the families and children because of my specialty, but all disciplines were working parallel. 28 lecture halls of all kinds of all medicines. That reflects something, that Egypt had the expertise and we can offer something. Now we gave an idea, unprecedented, that Egypt can have something to give and to share with international community and with the African continent.
Yes, during the first African Health Conference, President Abdel al-Sisi stated that we have a lot of hurdles in terms of cooperation between Egypt and Africa in different fields.
Yes.
Today we are focusing on the field of health and the development of the health sector for Egypt and for the Africans as well. What are the main hurdles, in your opinion, in terms of developing the cooperation between Egypt and Africa? And despite that, His Excellency President al-Sisi also stated that despite the hurdles, we can achieve the goals that we have set to ourselves. What are the goals and what are the hurdles that are facing us?
Absolutely. Holding and planning for that conference wouldn't come without, if you don't have something valuable to give to others, nobody is going to come to you.
Yes.
So Egypt has passed through a very valuable experience before the corona and then after the corona.
Yes.
Before the corona, we all remember the 100 million health initiatives. Today, among the speakers was the Secretary General of the World Health Organization. He has said that that is a remarkable event in the history of mankind. It has never happened before. Also, a Nobel Prize laureate who discovered the virus. See, as a student, we were dealing with hepatitis A, hepatitis B, and non-E, non-B.
Yes.
He was the first physician to say there is another virus and proved to be virus C. He came today and he said what Egypt has done in the file of viral C hepatitis, which he discovers, is unprecedented, you know. In the scale of screening over 50 million subjects, diagnosing more than 2.5 infected with the virus, giving them the medication, and very soon declaring Egypt as free from hepatitis C that you can give to the African fellows, and the president has promised that Egypt will put all its expertise and facilities with and for the help of all African nations. That's one file we can share. The other file was the coronavirus. Egypt has done remarkably well in the coronavirus. Remember, we're the first country to get the vaccination, to share in the vaccination. We got the Chinese company manufacturing it, and today the president pledged to offer 30 million doses for the African citizens in all Africa. The other thing that was quite a very good experience, the wholesale, what we call it, the unified procurement. This is the supplies which we used to give in a retail manner. Now getting whole what the country needs for all hospitals, from all medical supplies and instruments and all this kind of thing. It saves money and makes you plan in a good way. That's another experience. The third is the Egyptian Drug Authority and the new medicinal city, Al-Khanka and Al-Qalyubiyya, where Egypt is about to get self-satisfaction with all the medicines, except, of course, some rare medicines, but also we're having contracts with the international companies to get that manufactured in Egypt. So all these experiences we can offer to the African continent. One final thing is the human factor. So they were speaking today, the president and the Minister of Higher Education, about the expertise. The conference and the exhibitions will speak about workshops to train people, also medical education, continuous professional development, operations. We have, as we class A surgeons, which just we in Mansoura, we just have our convoy coming back from Kazakhstan and Uzbekistan and Pakistan and Thailand. They are doing fantastic surgery there. Also, in Africa, we used to have many African physicians who came to the urology and nephrology center 3 times. This was sponsored by the Islamic and Development Bank. So we can offer something. And now Egypt is saying that we have the expertise, we have the facilities, and we above all, we have the will to donate, to give, to share, and to help the African continent. So it was a very successful day from my point of view. One of the days I was fortunate to attend among the thousands of people who came in. We have speakers from all over the world. We have witnesses. When I get a Nobel Prize laureate saying what Egypt has done in the fight of virus C is something that you should be proud of, and we really are proud of that.
So these were the steps or the procedures that Egypt could be offering to Africa and the world in terms of what we can do to the African continent. On the other hand, how do you see the main medical challenges that are now facing Africa, specifically after the coronavirus pandemic and after the crisis between Russia and Ukraine? It affected economically as well on the medical facilities in Africa. How do you see the main medical challenges that we could be helping in?
Yeah, that's the sad aspect, because Africa is very unfortunate in the scale of diseases and the magnitude of problems. I'll just give you 2 examples which were repeatedly mentioned today, and both fell in my specialty. There are around 500,000 maternal deaths each year because of pregnancy and its delivery and its complications. 90% occur in Africa. 90%. Cervical carcinoma, carcinoma of the cervix uteri, which is caused by a virus. Over 500,000 cases develop in the world, 90% or above, or more than 90% occur in Africa.
Yes.
HIV/AIDS, the largest population living with HIV/AIDS, the virus, what's called the immune deficiency virus, are in Africa. It would be in certain suburbs of South Africa, I would say 30% of women who are pregnant are positive for HIV. So the magnitude of the problems in Africa is not present in any parts. The whole population of Africa is equal to the whole population of China. But the diseases prevalent in Africa are so many times higher than even India, even China. So Africa looks for help. To be honest, I've met many African colleagues in the British soil. I've met colleagues, they are very good physicians from South Africa and Nigeria. And the four main countries in this continent, in addition to, of course, every country is very respectable, is Egypt and South Africa. Our colleagues, especially the British, used to say, why are you leaving Africa behind? We have the expertise, and now we have the will, and as we say, if there is a will, there is a way. We can find a way, and we have the expertise, we have the facilities, and we have the human factor who can do the difference in Africa. But definitely, Africa is very unfortunate. We don't like to speak about malaria, about a child death, about infant death. All these are among the highest in the world. There is no proportion, or there is no comparison between Africa and any other
and could be
country.
managed.
Mostly they are preventable. If we could say maternal mortality, 90% of maternal mortality are preventable. The carcinoma of the cervix, we don't see it now, it is rare in Egypt by way, but it is nearly disappearing from the world because of the vaccine and the screening. But Africa doesn't have vaccine, doesn't have the screening as well. Malaria is very prevalent, so now we are trying to get a vaccine for malaria. So we can do. I can tell you, in Mansoura in particular, we used to have a clinic in Addis Ababa that was 8 or 9. It was run by physicians settled there doing the job. I visited Addis Ababa, and during that time, Professor Magdi Yaqub came to perform cardiac surgery, and he was received, I had heard it, as a Christ. They met him as a Christ. He said,
in Ethiopia.
In Ethiopia, yeah. And many other countries, all the African countries. Now, today we have heard from the Vice President of Zimbabwe and from the health administrator or from Uganda. And both expressed their sorrow about the situation of healthcare in these countries, in addition to poverty, the magnitude of the disease, and we can help, and we should help. And now we have the political will, as I said. We can have convoys, we can do a lot, we can make the life of the African continents, countries much better, and we can build the trust. The President today has raised a very significant gesture that we go to Africa with open mind, with very, very goodwill to raise the standard of healthcare as the conference deals, as well as other fields.
Yes, you've mentioned, Doctor, that President Assisi directed his speech and his words to the pharmaceutical companies and saying that there are a lot of markets in Africa, and there is a possibility for new deals to be done and signed in Africa. How do you see the response of the pharmaceutical companies in the near future? Because we need to be acting fast.
Yeah, exactly. He categorically said that there are 1.3 billion Africans now, and in mostly 65% are in the youth group, below 30, and within 20 to 30 years, this number is ready to be doubled. So if you are investing, and he said, invest in Africa. If you want to make profit, you can make profit in Africa. And they can manufacture pharmaceutical drugs, as I would say, to be sold in Africa. So, of course, they have to make compromise and get it for a reasonable price, but you are making HIV/AIDS medication. It is not sold now in Europe because they can manage, but the market is really Africa. So the pharmaceutical companies, our experience with pharmaceutical companies, because we are a big pool of hepatitis C, which happened, Mr. Ahmed, is the cost of treatment in Egypt was $50 and in USA was $10,000 for the hepatitis C. You can imagine. Of course, this comes from because the physician who discovered that was Egyptian, was actually from Alexandria, who discovered the whole medication, but also because the companies understood that helping Egypt for a nominal fees or reduced fees will make the difference. So they, as we speak about the vaccine now, the least proportion of vaccine is distributed among African people. Why that? Now Egypt is going to donate 30 million doses of the vaccine. These are free, but if the other companies is going to do the same, that can make the difference as well.
Doctor, you mentioned that we will be donating, according to the pledges of President Assisi, will be donating about 30 million doses of the coronavirus vaccines. President Assisi also stated that we do have limited resources, but we intend to be having more cooperation. How do you see the response of the African states to such a statement?
It came in a very unplanned way. He said, we have over 100 million population. We are not a rich country, but we are not short of ideas. And the challenges makes opportunities. He repeated it. He said, a challenges makes opportunities, and we have to come up with new ideas and turn around and solve our problems. And he get a great applause because that was a very, very, very successful statements to say challenges makes opportunities. There are a lot of challenges in Africa, and these challenges are searching for opportunities, for ideas, and for cooperation. And he said, we will never give up. We will never give up. We have challenges, but we will never give up, and we will succeed. And Africa will have to succeed at that.
Yes, you mentioned also the Virus C campaign, because we witnessed, first of all, the Virus C campaign here in Egypt, a number of health initiatives in the past 8 years under the tenure of President Assisi. But the Virus C campaign itself, it was held in Egypt first and then propagated to Africa. How do you see the results of the Virus C campaign here in Egypt? Because I think we are reaching to be free of the Virus C in the country, and the same results in Africa.
As I said, the Secretary General of the WHO has declared that Egypt very soon will be declared free of hepatitis C.
Yes. And
that's a story, this is a story to tell. Also, Africa has to go on the footsteps of Egypt and do exactly the same. In the field of health, there has been the no waiting list. Again, the President today has said, we have done 1.3 million major surgeries. And some of these surgeries have cost, the cost was between 300 to $500,000, and some are much more. I lived this experience. I lived the experience as a dean of the medical school, and we used to, for example, there are very expensive operations, the one dealing with the coronary aneurysm, it cost £1 million. The one dealing with the valves replacement and the heart, the joint replacement, and the orthopedic surgery. All these are very costly, and there have been hundreds of patients waiting in pain and in despair. And all of a sudden, the government and by direct order from the President has done what has never been expected. I would tell, we were operating day after day, day and night, to try to cut short. Now, in the majority of cases, we have 2 to 3 weeks waiting list for a major surgery. I used to work in the UK for 7 years. The best in the UK on that scale would be 8 weeks. So now in Egypt, it's 3 weeks. Because the main obstacle is finding the fund. These operations are very costly. In addition to the investigative tools, which are expensive, but the medical supplies are now very, very expensive. That per se can consume 20 to 25% of the income of Egypt if we have to go on the same scale. But the country has decided, the president
and now
the
they're
government
being funded by the Long Live Egypt Fund?
Yes, they have. It is all funded by the Egyptian government. We used to do liver transplant, for the country. The government paid for that. The kidney transplant paid that. The spine surgery, the neurosurgery, the orthopedic surgery, cardiovascular surgery, all these were financed and funded by the government. Yes.
Yes. In the past 8 years as well, under the tenure of President Sisi, how do you see the progress of the production of drugs here in Egypt? Because what happened today was a result of what was happening in the past 2 or 3 years of localizing the industry of the production of drugs here in Egypt, like producing the vaccines. And this means that if we produce the vaccines here in Egypt, it will be easier to be exporting and to be helping the other African countries with about 30 million doses. So the main point here is the production of drugs in the country. How do you see the importance of such a step?
As I said, we wouldn't have this meeting, a mega meeting, without having the prerequisites for that. What are the prerequisites? You need to get staff, you need to give medicines and facilities. And all three are now available in Egypt. We have managed, by the help, by the good planning, by the cooperation with the international industries, we are about to say, yeah, we are 100% capable of producing our medicines, and we can donate and export to the whole African nations. Today, the Minister of Higher Education and Acting Minister for Health has said we moved from around 30 billion pounds to over 160 in just 6-7 years. So it's about 5 or more fold increase in the productivity of the medical supplies. Also the experience of the wholesale or the planning or the establishment of an authority that can give you every hospital in Egypt what it needs at the time and by the planning, that cuts the cost and at the same time makes it available. By good planning, things happened. Now, the president hoped that the whole Africa will go to the companies and they said, we are going to purchase all our needs as one African nation. Remember, this is going to cut the cost by 30 to 50%. So, by the way, the whole Gulf states, they do the same. And Turkey, all the medications and the supplies come in one. So we can do that. We can. There is, as I said, 5-6 very good initiatives Egypt put on the table today. They are ready to share with the African, and I think there is will. This time there is will to do, and Egypt can deliver.
Yes, Dr. Saied, we will be taking another report regarding the events that took place today at Al Manara International Conference Center and the holding of the first African Health Conference in Egypt with the presence of His Excellency President Abdel al-Sisi. All the details are in the upcoming report.
Egypt is one of the pioneering countries in the African continent that paid due attention to healthcare. Egypt is exerting great efforts in providing health services for all citizens through an integrated system for healthcare that would realize an overall coverage to the essential health services. This is being done through establishing primary healthcare units, upgrading the public and health insurance hospitals, and extending health insurance coverage to include all citizens. To achieve this, the state is allocating a percentage of government spending to health equivalent to at least 3% of gross national product, which shall gradually increase to comply with international standards. The state is also pressing forward with establishing a comprehensive health insurance system covering all diseases for all Egyptians. Amount of expenditure on health services reached around £42.4 billion in 2014-2015 against £33.5 billion in the modified budget of 2013-2014. Healthcare sector realized various tangible achievements on all levels. The number of public and university hospitals has reached 717 with around 98,000 beds. Maternal mortality rates plummeted in 2011 to 54 for every 100,000 live births, then plummeted to around 47.5 to every 100,000 live births in 2013-2014. More than 50 million citizens enjoy a health insurance coverage representing around 58% of Egypt's population in 2013-2014. Egypt is working hard on combating contagious diseases such as hepatitis C virus through launching national immunization campaigns and treatments. By the end of 2015, more than 15 hospitals in Cairo and other governorates have been inaugurated. In January 2014, 59 hospitals out of 438 governmental hospitals were developed to offer suitable health services for the Egyptians. This comes within the framework of the Hospitals Development Program that should be implemented all over the governorates.
Welcome back. You're still watching the Daily Debate, and I'm honored to be having with me in the studio tonight Dr. Saied Abdel, the former Dean of the Faculty of Medicine, the Mansoura University, and more recently the President of Horus University. Thank you very much for being with us once again. We were speaking about the initiatives that took place in Egypt in the field of health in the past 8 years under the tenure of President Sisi, and the initiatives that were put forward today during the first African Health Conference for the sake of Africa and the Egyptians as well. If we take a look back at the 100 million health initiative that was held here in Egypt, how did it affect positively the medical infrastructure in Egypt, especially that we had the coronavirus pandemic in the midst of all it?
Absolutely. Indeed, the 100 million health initiative was a great and very successful initiative.
Yes.
And that was followed straight away by the corona, and the performance of the government is again another success story. Now we're moving from a challenge to a challenge because of the conflict and the raised prices of the grains and the cut short of the power supply and petrol. And so over the last 8 years or so, we have moved not only in Egypt but all over the globe from our trial to stabilize the country, to fight terrorism and all this kind of thing, and then you have put very successful initiatives. Then you moved into a coronavirus pandemic that for the last 2 years we have seen what happened in the world.
Yes.
And there was crashes in the economy in most of the very powerful economies, not mentioning Africa or even Egypt.
Yes.
And then we moved into another crisis. So as the president has several said, alhamdulillah, and we thank God that, but this government has been working hard, and the president has been working absolutely hard over the last 6-7 years or so. What has been done in Egypt, and that's categorically what's mentioned by the foreign press. Egypt has witnessed over the last recent history from Muhammad Ali, the era of Muhammad Ali between the 1800 or 10 or 8 or whatever, till the end of the first half of the 19th century, and then Gamal Abdel Nasser era in the 60s, and then Sisi era. But what happened in the last 7 or 8 years, unprecedented, you know. We are speaking now about medicine only, but what happened in the transport, what happened in electricity, what happened in the cultivated lands, and invasion in the new cities, in the universities. It has been, I hope that one thing the President today addressed is we need stability and security and fighting terrorism in order for the initiatives and the progress to occur. But if we destroy the security and the stability, then not only Egypt, but any country that goes into civil war and that goes into terrorism, forget about the progress. So although there has been very hard time, not only locally but internationally, but the progress and full respect for the administration, including, of course, the President and the government, and every cabinet minister who has worked extremely hard. There has been change in Egypt, definitely.
Yes.
The fine thing is that, which is mentioned today, is we can reach every corner in the African continent by train. Now, we are speaking about the Cairo-Cape Town, which was a very noble aim for the British Empire to link the Cape Town and the south of the continent with Cairo. That now is possible because we have the ultra-speed train that's going to, in phase 2, from Tropa till Abu Simbel. Then it will be very close to Sudan, and then crossing to southern Sudan, Ethiopia, Kenya, Tanzania, Zambia, Zimbabwe, Botswana, and then you are in Cape Town. That become an achievable target. Nobody has ever, even the British Empire couldn't do it. The other thing that the train is going to west to Alexandria, Al Alamein, that's going to extend. Before the World War II, there was the coastal road extending to Libya, Tunisia, Algeria, Morocco, and then going to Palestine and the Eastern Gulf. So there has been definitely movement in every corner, in every day you see something. I come to Cairo, weekly there is a change. There is a change on the roads, on the safety, stability, and on the progress. And we hope that we can carry on. I hope we are fully optimistic, fully supportive, and fully backing the government in its initiative.
Yes, and we will be carrying on because the first African Health Conference will be replicated every year. This should be, or would be, an annual meeting for the representatives from the medical companies. We had about 2,000 representatives today, and
true.
we'll be meeting every year to be discussing the opportunities of how we should be or could be helping the Egyptians and to be helping the Africans at the same time. So it is a win for both sides, for the medical companies and for the patients. How do you see the importance of having this annual meeting here in Egypt?
There is a very good thing happened about this first African Health Exhibition and Conference.
Yes.
It's said today for the first time that the President has given the order to have that a year ago. I got this invitation to chair and to take part in this conference about 6 months ago. So Egypt has moved into a scientific planning. I know that in that time I am going to present my work for Sunday and Monday, and I'm chairing a session on Tuesday. So things have been planned for 6 months. You know, I got my accommodation booked 6 months ago. That is unprecedented. We have never seen that. So there is a bit of scientific preparation to the highest. Again, there are 4 ministries chairing and cooperating in building that. So the good planning will give a good result with this magnitude of things. Coming back to what you say, definitely the pharmaceutical companies, that is the #1 legal industry in the world. These companies are looking for Africa, and the President has said several times, and the Professor Khaled Al-Ghaffar, Egypt is the land of fortune. You know, Egypt and Africa could be the future for investment, and we hope so.
Yes, Dr. Saied Abdel, the former Dean of the Faculty of Medicine at Mansoura University and the President of Horus University. Thank you very much for being with us tonight on the Daily Debate.
Thank you for having me, and pleased to be with you, Mr. Ahmed. Thanks.
And this brings us to the end of the Daily Debate for tonight. Thank you for watching, and goodbye.